make a start because it's 11 o'clock. Thank you all very much for coming this morning. I'm James Kirk. I'm the director of the Social Market Foundation. I hope you're not lost. You haven't wandered into the wrong room. You know you're here for this event with the Social Market Foundation and Policy at Manchester. We are, like lots of people, slowly re-emerging from our pandemic chrysalis back into the real world. So this event is there's a hybrid element to this event. So I'm looking that way because I'm looking at the audience in the room, but I'm also aware that if I look over there's a camera which is currently sending this event direct to YouTube. So when we get on to the questions and discussion, we're hoping to get some contributions from our friends who are joining us online as well. So that's here. And if you see me and other people on the panels looking that way, that's why, because we're conscious that we're on camera. It's also why we're sitting very close together. Also because we like each other a lot. So the topic I'm sure you're aware we are here to talk about is health and well-being in housing and urban planning. In a second, I will hand over to our first speaker, Chana Coxall from the University of Manchester. Just to reiterate, the reason we are here for the banner, that banner there, is for Policy at Manchester, who are the outreach and impact arm of Manchester University. I'm very pleased to work with at the SMF. We will then hear from Dr. Sue Chadwick, who's the strategic planning advisor for Vincent Masons. And finally, we'll hear from Dr. Daniel Slade from the Town Country Planning Association. I've just suddenly realised I'm the only person on this table who doesn't have a doctorate, so I'm feeling slightly intimidated by that. You don't have to have a postgraduate degree to ask questions later on, so that's. I think the. Forgive me. I've been doing this on Zoom for 2 years, so I can't quite remember what the housekeeping of these events is. I think I need to say something about fire alarms. If there's a fire alarm, then that's the exit over there. And just to reiterate the point on the YouTubing and the streaming, what that means is that the event will stay up online forever. So you are, when we come to questions, I do hope we'll get thoughts and contributions from those of you in the room. Then your contributions will be recorded and immortalised online via that YouTube channel. I'm about to look at one of my colleagues and ask them to remind me as to the hashtag that people should be using when they're tweeting about this fire. Have we an official hashtag? Hashtag healthy homes. So again, this is primarily for the online audience. If you want to chat questions at us via Twitter, use the hashtag healthy homes, or use the Social Market Foundation Twitter handle. We'll also be keeping an eye on the chat panel of YouTube. Is that what it's called? Chat panel? I'm old, sorry. So we can get questions there as well. So I think that's about all from me. We will, before I hand over to Chai and his opening thoughts. I think later on, when we get into the discussion around this topic, inevitably words like levelling up are going to be used. And so anybody who's got particular thoughts on how we can mesh this topic into the grand crusade and campaign and mission of the government and the one and only Michael Gove, much appreciated. So with that, I think I'm going to. I was about to say mute myself because I really am. I really am still in those habits. I will figuratively mute myself and hand over to Chava.
Thank you, James. My name is Çağlar. I'm a lecturer in urban planning in the University of Manchester, and I'm an urban planner, and my research focuses on infrastructure planning and healthy cities. And I'm very pleased to be here. I think this is my first in-person event in 2 years, so I'm still trying to get the grips with the people in the room. They're not on my screen, so apologies if I do something stupid. So when I was asked to come to this primarily because of my recent article in the publication called Building Utopia from Policy at Manchester, where I talk about how we can incorporate health and well-being in housing developments. I was specifically thinking about Northwest, but that's also applicable to the rest of the country. I was drawing on our new research project. This is called Truth, TRUUD. It basically means that tackling root causes of bad urban development's upstream decision-making process. It's a mouthful, but essentially it means that how we can make health a priority in complex urban decision-making process, urban development decision-making process. This is funded by Medical Research Council and UK PRP, UK Prevention and Research Program, basically a partnership between biggest research councils. We just finished 127 interviews. And unlike most other urban planning projects, we mostly interview developers, financial institutes, banks, landowners, as well as people from public health and field planners as well. Because our idea was that creating healthy homes and houses and neighborhoods is not just something that planners can do or planning system is designed for. We need a more holistic or systems approach that will bring a lot of people that also includes developers, landowners, councillors onto the table to help us to actually figure out how we can do that. So far, the approach has been that quite siloed and departmentalized and fragmented, which led to a lot of bad developments that I think some of other panelists will talk about a bit later as well. So what we found with the 127 interviews we concluded is that it's a complex system. So £10 million well spent. Thank you very much, Medical Research Council. What we all found is that it's a multi-actor, multi-sector, and multi-level. That's what we need to be looking at. What multi-actor means is that we need people from public health, people from development, people from House Builders Federation. We need councillors, we need officers, we need quite a wide variety of group of people on the same table to think about how we can create healthy homes and healthy neighborhoods. It's also multi-sector. It's not just about planning or transport or other sectoral policies, but it's about having this kind of holistic approach to healthy planning. It's also multi-level. It's nothing to the national policies, legislation can only do so far, or local politicians have so much power, only have a limited amount of power. We need support from both at the national, top down. We also need some bottom up, middling out, perhaps, support to be able to create health homes and developments. One of the key things that we found is that the question about what does health mean? When we said, we need to create healthy outcomes, we need to embed health into housing developments, there was a lot of questions, especially coming from developers asking, what do you mean by health? They are much more comfortable using well-being, because when you use well-being on brochures, you will see happy people running around, people sitting on benches, being happy and smiling. But when you say health, it has this negative connotation that, it also brings people, ill health, or they being sick, or waiting in A&E for 4 or 5 hours. So health is not a good material to work with, but well-being they found is much easier. So when we say health as a built environment professionals, this is one of the things that we're trying to look in our research projects at, how we can clarify what health means. When we say health outcome, what exactly do we mean? Life expectancy has been brought up by several people, but we found that that's not the best way of measuring health outcomes, especially when you're young and when you have a family, you're just starting your life. So these are the issues that we've been trying to cover. In terms of my introductory statement, I think one of the key things that we need to, I think what we need when we're trying to create health homes and neighborhoods is the clarity. Clarity, that's what we mean by health. Clarity by who we need, whose help we need, and especially when it comes to the developments, especially in the UK, which is primarily market-led, we need to also be very clear that how the developer is going to pay for the bill and what's in it for them. Because one thing that people tend to forget is that most of the housing developments or any development you will see outside the window is actually paid by private capital. And unless developers find a way to make a profit out of it, there is no reason for them to actually create healthy homes. They are in this business to make profits. So I think one of the key things that at least what we're trying to do in this project is how to embed health or create a healthy net gain or viability system where we also see that developers are actually taking advantage of. So they're also incentivized to create healthy homes and neighborhoods. And that's it from me, if that's okay.
Thank you very much, Dana. I won't ask questions now. I'll do it later on. We've heard from our other contributors, but I'm very keen to explore those questions you raise around measurement and how we go about deciding what is what are good health outcomes and how they can be related. Because you've rightly preempted some of my questions around life expectancy. That's definitely one of the things I think we want to talk about. Our next contributor, our next doctor, is Dr. Chadwick, Sue Chadwick, the strategic planning advisor from Pinsent Masons, who I'm sure has thoughts on, almost following on seamlessly from Charles' final points there about the developer community and motivations and action, possibly, but maybe not. Who knows? We'll see. What do you make of this?
Okay, thanks, James, and thank you to everybody who's made the effort to get here today. I managed to get 20,000 steps in just to get here, so well done, everyone. I think I want to make 3 small points, all of which I can go over again if anybody's particularly interested in questions and things. Firstly, that this is not a new problem for planning. I was just talking to Daniel, as you do, about Ebenezer Howard and Garden Cities of Tomorrow. And that was written, I think, 1903. It was rapidly followed by the first ever planning legislation. And obviously, as a planning lawyer, what I do is go home at night and read up the debates from the 1909 Planning Act. And I have done that. And one of the things that George Burns, when he was introducing that act, said that it was not fair to the poor to develop in a way that made their environments unfriendly and unhealthy. He said, then this bill will be something that will allow us to exploit the natural and physical opportunities of land. And he finished, and I've never found a better way of saying this, to the benefit not only of the present generation, but particularly of children who are cursed, many of them, in their habitations and environment. Now, this is 40, 50 years after cholera epidemics in London, so he's got a particular perspective on that. But I think the sort of sad reflection is that 115 years later, we're not really very much further on. We are still creating really poor housing, particularly from the changes in permitted development, that is still contributing to poor outcomes. And one of the questions was, is the framework good enough? And no, it's not. But as a lawyer here, I would say that the problem is deeper than the framework. The problem is the definition of land in the 1990 Act, which is pretty old anyway. But that definition of land, and here I just weep for my profession, land is defined as a corporeal hereditament. Only lawyers could come up with that way of defining land. But the problem for planning...
What's a technical term for that?
Well, exactly. That's a technical term for people who are paid to find complex ways of describing simple stuff, I think. But the problem for planning is that it means that the entire planning law system is based on a definition of land that is welded to the physical fabric. And then there's a sort of subsidiary problem from that, because as any of you know anything about planning know, to take anything into account, it has to be a material consideration. And the House, I think it was the Supreme Court a couple of years ago, said material considerations have to be to do with land, which means the material considerations have to be to do with physical land. And that makes it difficult to attach health outcomes to planning decisions, even in a sort of straight legal way. Now, I could talk in great detail about the case law about material considerations. I won't. I would make one final point, which is that if we really wanted to change, Michael Gove could stand up tomorrow in Parliament. Well, it wouldn't be, it could be tomorrow in Parliament and say, here's a new written ministerial statement. As of today, health considerations are to be a material consideration. That would change things immediately because it would make it easier for local authorities to take these things into account. It would mean that developers would come to the table with a planning application knowing that health would be scrutinised. Plenty more I can say, but I'm going to let Daniel have his say as well.
Thank you. So I want to talk more about that, that putative ministerial statement, because I think that's very interesting. I'm also very keen to get you to pick up on some of the points, or the question, I suppose, that Chala posed about developers and their motivations. We'll have to put you on notice of the question I'm going to ask. But you're as a very well-mannered panelist, you're introducing your next our next speaker, the latest Dr. Daniel Slade.
Thanks. So I really appreciated the reference, I think, to the TCPA and the foundations of the TCPA too. And it's really interesting. The TCPA were founded in 1899 for to confront exactly these issues. Partly it was a practical response to the growth of Victorian slums and industrialization and trying to find a practical response to that. It was also, though, about the idea of building utopia. I think holding a quite abstract concept in your head like utopia and having something to pursue and this idea that you can make things fundamentally better is a really important starting point for starting to address these issues, from the practical, minute and legal all the way up to the kind of system change and political change we want to see. So I think as a starting point, system change is a good place to begin. Completely agree with Sue about some of the system changes she wants to see. I think in the very first place, though, really basically, one of the first things we can fix to do a better job of planning for healthy places and houses is addressing the extreme levels of under-resourcing you see all across the system, especially just throughout local government. I mean, many local planning authorities can barely do their statutory functions. And there's digging into that a little bit more, the way it plays out is there's this retrenchment away from policy making and looking to the future and trying to be creative with solutions, working across public health teams, planning teams and housing teams, and just bringing it back in to focus on processing applications. And as much as that's important, and it's something local authorities need to be efficient at doing, it's just basically not good enough. There's so much more we can do, and it's not preventative. In the very first place, the planning system was supposed to stop people getting ill, and then the NHS was supposed to fix them if they did get ill. And half of that is just really fundamentally broken. Permitted development has already been mentioned, but I think it's worth digging into a little bit. We're allowing homes to be built in the middle of industrial estates, converted office blocks, in the middle of warehousing districts, on the edge of main roads, completely isolated from any sort of public infrastructure or social infrastructure. There's somewhere like well above 100,000 homes have been delivered through that route so far. Not all of them are terrible, but some are unacceptably terrible. But I think that's symptomatic of a way of thinking about the role of regulation in society and the job it plays in trying to ensure high quality environments. And I think it points to the need again for system change. So I think that where that gets us up to is, the way I've been thinking about this all stems from a question I got asked at a conference. It was the first one I did after lockdown. Someone asked me, so how can we actually make healthy homes viable? And it just struck me as incredibly perverse. We're in a situation where the whole point of the system is to generate homes which are good to live in, enough homes, but homes which are good to live in. How can we be starting from the starting point of trying to make the kind of things where we need to produce fundamentally at a biological level viable? I mean, that should be the starting point for system design, and then we should be working out from that and creating a system which delivers those things. So I think the answer to that is making sure that the kind of homes we need are priced in from the beginning in business models. For far too long, I think developers have been relying on business models which are actually built on building homes which are basically not good enough. So I think that's the starting point. I think the answer and the fastest way to do that are just the universal standards which apply to all new homes built in any scenario for any route, whether that's permitted development or the planning system proper. So I think that's probably my main point. I think there's arguments to be made around a legally defined purpose for planning, which I think is a subject Sue can speak to as well. And I'd end by saying, as Sue said, this is all doable. This is eminently doable. To to try and make that point, we've written the legislation which would begin to bring this change around. That's for our Healthy Homes campaign. And we're seeking amendments to the Building Safety Bill, which could go some way to starting this case. But that evidence base and the work being done at the University of Manchester is really fundamentally important to that case.
Thank you very much, Daniel. Can I'm going to start actually by asking a question of all three of you, in fact, which is almost the generic question that we often find ourselves asking in lots of different bits of our work at the SMF, which is obviously we're talking about, well, I think we're talking about Britain. Are we talking about Britain or are we talking about England particularly? But we're talking about this country of. And very often the question we encounter, and we like to ask, and we know that people in government particularly, if there's one question we're most often asked by people in departments, in politics and parliament, they always want to know, okay, well, that's what we do, and you identify the problems with our system. What do other people do? Are there other countries, other examples of systems elsewhere where this stuff works better? Who can and should we be learning from internationally? So, Charlotte, is that one for you?
Yeah. I don't know how much internationally you want to go, but we're talking about England.
Yeah.
Because the planning, as far as the planning system is concerned, UK United Kingdom has 4 different planning systems. Each devolved nations there have their own planning system. Not too dissimilar from what we have in England, but has striking differences. And I'll dare say Scotland is slightly better than what we have here in terms of embedding planning outcomes into their planning system. At the moment, 20-minute neighbourhoods is a very big topic, which is essentially means that each neighbourhood should have essential services within a 20-minute walking distance for every resident. And it is a part of the purpose of the planning system in Scotland. In Wales, they enacted a law called Wellbeing of the Future Generations, I think, in 2015, which essentially means that the right of the future generations should be considered when you're making planning decisions. When it comes to other countries, in terms of where we can actually learn good developments and good things are happening, what comes to mind easily is the Denmark, Netherlands, usually giving the best examples of the actual.
If in doubt,
yeah, but when you're looking at the countries in global south, including the countries in Africa, Latin America, or countries like Turkey and China, it's hard to say that there is a one good practice you can easily incorporate into England, because we have quite a different planning system, different cultural history. It's not easy to transfer things from A to B, but there's thousands of good examples around the world that you can draw on. Community-led developments in Latin America has a huge success in Latin America. The government bending down, the government pushing whatever they want to do in some countries in global south is also another good example, improving public health. So there's a lot of examples, but I think the challenge here is that we need to be mindful of the particular challenges we have in this country, which is also the strengths in terms of the discretionary nature of our planning system, the flexibility that it provides, and also the way that the good developments are happening. I will say that not everything is bad in England. Some things are actually quite world leading. So rather than looking at international, I would more be interested actually looking at what's good happening in, say, in northwest or northeast, or in other parts of England.
Thank you. Sue, any thoughts from either of you on the international comparison? Not mandatory.
No, I'm not going to even pretend I'm an expert on planning systems in other countries, but I hear things like, 15-minute city, and I know that Paris and Hidalgo is a great promoter of the 15-minute city. On the other hand, Paris has its banlieue and its own problems, and the Gilets jaunes and all the rest of it. So I think the problems of planning are more fundamental than that. Every country deals with the conflict between the need to make money and the need to have a good environment in its own way, with its own successes and failures. But what I've seen over a 30-year career is I mean, I started in planning in 1984. So I've sort of come from that very much development-led planning that gave us those low-level shopping centres and the Pizza Hut-style developments that were very much criticised in the 80s. And then through a more plan-led planning 1990s, where very much it was the developers complaining about the gravy train of public benefits they were expected to provide. And now I see the pendulum swinging the other way. So I would say, I would more like with Chalar, look to our own past, look to what's worked in England and learn from that. And for me, the most successful developments are those where the landowner is either public or has access to more control over the land. I've been involved in some very successful developments at Cambridge, but that was because there was a university that had an investment in a good future, because the planning problems would have come, the university wants to be able to have a successful development because it will be there if there are problems. And that was very much the Garden City ethos, that the landowner would be responsible in the long term. And I think when you have that long-term responsibility, and of course the model communities, Saltaire, Bourneville, you have a philosophy underneath it and you have a long-term responsibility, that seems to work on a very simple level.
You're coming to one of my favourite subjects, which is responsible capitalism and long-termism. And I'm going to come back to that point because it links back to the question I prefigured earlier on about developers' motivations. But before I want to come back to that in a second, I'm going to give Daniel a chance to come in on the. And you're right to correct me on. We shouldn't just look for international comparisons; look for intranational comparisons as well. So, your thoughts on other good examples of good practice around the world, but also good practice in these islands, Daniel.
I was going to say exactly the same thing. We're so good at looking to other places and try to do it so often. Looking to other times is just as significant. I was going to point to the Newtowns programme for better and for worse. It shows the scale of transformation which can come about when the state works actively with developers, proactively trying to produce certain outcomes. There are those lessons there around stewardship and the insignificance of infrastructure, again, for better and for worse, because it went terribly wrong in some places and extremely well in other places. I think it does show the importance of ambition within all this. And I mentioned earlier the importance of holding ideas like utopia in your mind when you're thinking about these things. And I think that plays into the lessons we saw in the Newtowns programs too.
Thank you. I should say on this point about international comparisons, since we're among friends, it's an intimate gathering. I can confess a trade secret of running a think tank, which is if you want to get political attention and buy-in for any proposal, it may have been dreamt up in Leicester or Cornwall, but actually if you say they do it in Singapore, then all of a sudden everybody in Whitehall gets very excited. So anyway, YouTube can forget that one. Please leave that bit. The question I want to come on to, which Sue raised, was about developer motivation, because Chalar said earlier on that part of the issue here is that we have a market structure where the incentives are on developers to make money, to return a profit on capital, to return to investors, and that's essentially the only motivation that counts. And so I think you said we end up with poor quality housing that does not take proper account of the health dimension. And can I play the rose-tinted optimist here, Sharon, and say, is that always true? Is it always the case that developers are solely motivated by the profit motive? Because aren't we currently hearing an awful lot about ESG and responsible capitalism and people wanting to have social impact in their economic behaviour? So are there any examples of people who are choosing to forego a bit of profit in order to deliver healthier housing, do you think?
I mean, if it was a question to me, I would say 100% yes. So RTPI did a research a few years ago looking into the housing developments built by the local authorities, which doesn't have, they have profit, they are for-profit companies, but most of the profit are going back to the company itself. But the question is that how much of them, compared to the thousands of homes being built every year, we're building close to 300,000 homes every year. Among that, 10%, 5%, and who can blame them? I mean, the private developers exist to make a return on their money so they can survive. It's a very risky business. The question is how we're going to make it, developing healthy homes and neighborhoods, a profitable enterprise, so we can make developers coming in and actually building homes that we want them to build.
So obviously you're dealing with sort of the actors in the market quite regularly. I mean, you mentioned University of Cambridge, obviously not a non-profit, or, a big investor capable of taking that long-term view, but not motivated by profit in the same way.
Yeah.
It wants to have sustainable investments, but I mean, in terms of the commercial players, is that ESG responsible capitalism agenda really starting to change behaviour, do you think, or is it more PR than substance?
It's
a very crude and simplified question.
It's a yes and no answer. I've worked with a number of developers who were purely motivated by profit, and that was particularly when those first changes came through to permitted development for residential dwellings. They were simply, and this would have been 2015, 2016, they were simply there to make as much as to take a poor quality office building and make it into even poorer quality residential dwellings. But I was at a meeting yesterday with the great and the good of the property development industry in London, where there was a great deal of debate as to how they could support local authorities to do Article 4 directions. And those are the one remaining power that local authorities have to restrict permitted development. I was surprised, because I'm a default cynic now, but I was surprised by how much energy there was in the room to prevent the whole-scale sort of deconstruction of the planning system by allowing these global permitted development rights, because there are a number of London boroughs now who are trying to get Article 4 directions, and that was supported by the entire room. So I would say that is definitely not that is not a profit motive. That is not an anti-profit motive, but it was a quality motive. And I think when it's about longevity again, there is, as well as a need to make money, there is also a pride in the developments, and there is a competitive pride in developments between the big players in London. So they may not be motivated by social good, but there is a sort of, my development is more ESG friendly than your development going on. And fair enough, if it creates better developments, then good. And on the practical side, and this again is a call for national change, what about tax incentives for developments that create healthy outcomes? What about a SIL rebate equivalent to the SIL rebate you get for social housing, for housing that's demonstrably going to contribute to healthy outcomes? There are things that can be done.
Good question. What about them? Are they good ideas? SIL rebates, tax incentives? Daniel.
I'm not sure. I mean,
you were expecting that. We'll come back to ESG and social purpose in a moment. But
yeah, I mean, I was gonna say in the first place, I think in some places it makes really good sense in terms of business models and profit margins to build really good quality homes. I think that's really important to say in the first place. The problem is in places where the property market is less buoyant, that's where the real challenges are. I think that's what we've got to focus our attention on, which is less an issue around SIL rebates and more, I think, regulatory one. There's really good research from Professor Matthew Carmona at UCL looking at large-scale housing developments across the country, trying to get a baseline idea of the quality of them according to the government's own policy and guidance on design quality. In some parts of the country actually have quite good quality housing stock being built at the moment, and other parts it's just completely unacceptably bad, even according to the government's own policy guidelines. So I think it's about focusing attention on those places in the first place. I mean, it could all be better, but focusing attention on places where the market doesn't support good quality housing in the first place.
Thank you. The next question I want you to get thoughts from all of you on was something that, again, I think was raised slightly in Sue's opening contribution, because it struck me that what you're talking about when you talk about the legal definition of land and the effect that has on policy, that made me think that that's effectively the legal incarnation of a problem that we come across quite often in this postcode. Here we are in West, the heart of Westminster, the siloing effect. So we're talking about housing and we're talking about health. And at an administrative level, there's an issue because housing is done in a building over there, literally it is over there, and health is done in a building over there. And they are different policy areas, different ministers, all the rest of it. And that's entrenched by law, as you describe. Is there, do you think, I don't know if anyone wants to throw themselves on this one first, is there a case for trying to look afresh at the machinery of government around health and housing to try to break down the walls of the silos? Actually, if you break down the walls of the silos, they fall over. But what's the bureaucratic remedy to some of the challenges we're identifying here?
Okay, well, I think this shows the benefit of being in a place with real people, because I've never thought about this before. So you're getting fresh off the top of my brain at the moment. But we've got the Levelling Up paper, and we've got an aim to regenerate cities and towns, and a commitment to improve compulsory purchase powers. Why not have a new compulsory purchase power to enable people to buy land at a reasonable cost for health-based places where, rather than having the church as the hub of the development, which is, frankly, the model villages and the model towns, have the hospital. And as Chalal said, we have a problem with health because it reminds us of our own mortality in a way that well-being doesn't. But if you have the hospital or the health hub as the focus of a development, then the housing that draws around it can be more focused towards that health. And we have ill health at the centre of our communities, but those facilities could also have sports and leisure associated with them, and retail, and culture, and housing. I mean, you've asked me to be utopian. Here's a lawyer being utopian, and it could stem from something as simple as a new compulsory purchase power that had health as its outcome, that would allow local authorities to get land at a price that would enable them to produce goods as well as just basics from that land.
This is good think tanking.
Well, this is all my creativity for the whole year, probably. So
this is what we're here to do. That's a really fun idea. You're going to regret saying that. I may ask you to write a paper on that. Yes, no. Who wants to? Keep writing the papers on. What's the next chapter of our new planning policies?
We could go even bigger, and this is a bit of a provocation, I suppose, but I don't think it'd be the worst thing in the world for the planning system to sit under the auspices of the NHS. Yes, I think. Yeah, well, obviously we're heading for the inevitable future when Britain is essentially run by the NHS. For us keen fans of the NHS, I think when Simon Stevens was still running NHS England, I think that was a very real possibility. But under new management, ambitions are slightly less imperial. Chella, what do you think? I think Blue Sky's rewriting of.
I'm not really an optimist guy, and I'm usually pessimist in the room, and I'm going to be boring here. I'm going to say that I don't think there are shortcuts. I don't think there are easy way of doing this. I don't think if we change, where planner sits, or if we write a new ministerial statement, I don't think it's going to make any change. Well, that's my opinion anyway, and it's because what we need is, as Daniel said when he was talking, there's a systems change, and the only way to make a system, you need to make interventions in different points, in different places, at different times to create that systematic change within a system. And to be able to do that, you need every actor within that system on board supporting you. You need developers who are actually building those homes, taking that business risk on the table, agreeing with you, supporting you. You need local councillors who have to take bold decisions against their best judgment on the table with you. You need local government officers supporting you. You need also the public who may, for a variety of reasons, not agree with the proposal you're putting forward. You may say we're going to create health homes. They would like to say, we don't want any homes. We just keep our green spaces intact, and then have nature just be buoyant and then expand. You may say, I'm going to create cycle lanes, I'm going to force every one of you to cycle. They might say, you know what, actually I'm disabled, I need to use my cars. So I think we need support. We need this constellation of actors. We have the constellation of actors: developers, landowners, government, local government officers, councillors, and we need support of every one of them if we actually want to create healthy homes and healthy neighborhoods. This is what we call in academia a wicked problem. A problem that doesn't have a single shortcut solution. As a complex problem, needs a complex intervention in the system to be able to make changes. And
which is a great. We're always fascinated by those wicked problems at the SMF. I mean, in many ways, that's what think tanks should be looking at. I occasionally joke that and I may now we're all back in the same room. I may resurrect the plan. Once upon a time, I did threaten to get T-shirts made for all the SMF staff, which just said it's more complicated than that. To remind us that whenever we think we've come up with an idea that will crack a problem, we almost certainly haven't. Now. I want to ask one last question before I try to drag in literally physically our audience and our electronic audience, which actually arises from, again, Sue said the magic words levelling up, and you talked about the health, some of the health outcomes and the planning outcomes that are identified in the many levelling up missions. One of the levelling up missions is on healthy life expectancy. I mean, it's restating an existing government commitment to deliver another 5 years in average healthy life expectancy, but also narrow the gaps between places on healthy life expectancy. But Chara, in your opening remarks, you said you thought that actually life expectancy is a poor way of measuring health.
Not a cool way.
Pardon?
Not a cool way.
An uncool way of measuring health, which obviously raises the question: what is a cool way of measuring health? How should we measure health and health outcomes here? I
wish I knew the answer. Then that will solve a lot of problems. We talk to a lot of people. There's plenty of research out there. There's a lot of models, a lot of different ways of measuring it. There's no single way because there's no other two local authority areas. Local areas are actually similar, same. In one place in Greater Manchester, for example, asthma cases are increasing in children below age of 10, and their focus at the moment is air pollution. Life expectancy doesn't mean anything to them because they have a very acute problem at the moment they need to deal with. In other places, in perhaps in Shire, the county areas, the life expectancy is the bigger issue. I think what we need is a measurement system whereby it takes the acute local problems into account so that the planners can actually, or wider system actors can address those issues. One of the things that we're hoping to try to figure out is there's an idea called health net gain. So this has been going around, people mentioning in the last 10 or 15 years. Essentially, this is modeled after the biodiversity net gain. The idea is basically to increase health outcomes, whatever you want to measure, by 10, 15, or 20% every time you're building new homes or creating new neighborhoods. This could be done by creating in a neighborhood that is conducive to a healthier lifestyle, or limiting such as takeaway or hot food, takeaway shops, or creating places that more resembling 20-minute neighborhoods. So there are many different ways of doing that, and planners know that, public health professionals know that the issue is that actually quantifying in a way that will bring the monies from the government, and it will be suitable for the Green Book way of assessment and then getting the money. I think leveling up is opening up the conversation. Lots of people talking about right now is that how we can actually take advantage of this national conversation. For example, in Manchester, life expectancy has been declining compared to the rest of the country, which has been increasing. And when you look at the COVID, people dying from COVID, that Manchester has been one of the worst areas in the whole country, which is really a shame because it's a lovely place to live. But when you look at the data behind it, you see how entrenched health inequalities are in Manchester, despite all the recent investment in Manchester, and then the prosperity has been bringing. And I think the housing has a huge role addressing these health inequalities. But the issue has been who's going to pay the bill? How are we going to convince the people who are actually building those homes, who are actually creating homes that we need already? They also need to go a bit further and foot the bill so that we can also address the health issues. I think this has been the key challenge, and we're trying to find out ways in which that we can actually, as Daniel said, make healthy homes viable.
Thank you. Daniel, I see you doing active research on your iPad. You're there. Fill in some of the gaps on this measurement question. How to best measure health?
Well, I think my main point around evidence and measurement would be that there's a vast amount of evidence out there. Public health teams have to collect it, and this is why I was checking on my iPad. They have to produce local health and wellbeing strategies, and they're really significant. I think that requirement's relatively recent, and it's a very important one. And it's about joining that up with planning and actually trying to get planners to use that evidence base which exists. The other thing I scrolled down when I was looking through this was that something which would help massively with a lot of this, and I don't think it's been mentioned yet, is devolution and genuine devolution. And that helps break through these silos at the local level. And it also ties into this point about funding as well. And local authorities and combined authorities genuinely having their freedom to use their funding in ways which join up all these evidence bases and get these teams working together properly.
Thank you. So do you have thoughts on measuring health, or as a heartless lawyer, do you
I think empirical measurement is brilliant because it keeps the lawyers out of it. If you have a term like policies for the supply of housing or material considerations, that's just two phrases that have found themselves in the Supreme Court in the last 5 years. The money that is wasted, I mean, nobody benefits from their arguments over the meaning of terms like that except the lawyers. So metrics, perfect, because it keeps us out, really. Yes, a devolution, development corporations, large-scale metropolitan authorities given powers, horizontal as well as vertical, that also works in planning terms. Yeah.
Thank you. So we're getting about the last 10 minutes. Are there any questions from the room? I've got one electronic question in front of me at the moment, but no one is waving limbs. In fact, I'm going to be biased against my colleague Richard, who doesn't get to ask questions. The gentleman in the blue jacket. We have a microphone as well, or you can shout.
Centre stage here. Hi, I'm Khalid. I'm from Mental Health Services within the NHS. I'm at the NHS Providers Policy Board as well. Mental health affects all, especially around good housing, a lot of daylight within the houses. The family hub model that the government announced last year, which I got one of the local authorities in Luton to apply for, is a great model that is based about communities and young people's mental health, where the local communities can go and access a lot of the healthcare services that they will need. They need to implement that within the housing sectors as well. So having a family hub in a new housing centre will be ideal. That's my point.
Thank you very much. Any thoughts on family hubs and mental health? Daniel, you're not. So I'm going to take it as yes.
Yeah. Well, I don't know. I think it comes down to this point about strategic planning and making sure that the NHS and other actors are involved as early as possible in making decisions about new developments and trying to build these proactively into local infrastructure and housing and putting that all together. And I think that will be much more achievable with devolution and more power sitting at the right local levels to do that. Without places like even the combined authorities with metro mayors having to go to central government for major infrastructure, for the money to do that, and the sort of the powers to deliver it. I think that all comes together. Yeah.
Thank you. Charles, any thoughts on?
Well, if we are going to define things, then we should define health as in a holistic way to avoid this way we've got defined land that should include mental health. And be absolutely upfront that that's as important as physical health in terms of longevity and general quality of life, and that the built environment can contribute to that as well.
I just agree with the other panelists that it's an important topic, and one of the key things that has been ignored is that, as just Sue mentioned, that mental health almost like a taboo that people to talk about, and the links between the built environment and mental health has not been, clearly established. Maybe have been established from public health perspective, but hasn't been established very well for us built environment professionals, especially for planners. So any more evidence to help us actually build on that, that would be excellent. So having some good examples, Luton, that will be perfect, so that we can actually upscale that and then try it in other places.
Yes,
I think it's interesting if you look at the national level. We mentioned silos before, where the kind of blockages are. So we've done a lot of work in the past with the NHS, and they've taken the role of planning and housing extremely seriously in relation to health and wellbeing just across the board. What was Public Health England took it extremely seriously. Government departments like BEIS have as well in various ways. And then the barrier always seems to be the Department for Levelling Up, what is now that. And I think that's that departmental focus on just housing delivery, and that this planning system is somehow a housing delivery mechanism in terms of numbers. But the rest of government seems to be quite clued up as to the significance of planning for delivering on this agenda, and not just in housing delivery terms. So there's work to be done there, I think, with across the departments, and the case being made by the NHS and its department and the other departments, and working across government that way. But it's interesting to see where the actual blockage is there and that kind of silo effect.
Thank you very much. Now, my technical skills, you may be able to gather now. Oh, sorry, you'd like to come back?
Yeah, I just want to come back. What I often see, my brother's a member of Parliament as well in Labour. We have some difficult conversations because I'm always chasing funding for mental health services. In the last 10 years, pre-pandemic for COVID, we've seen every year we had to save money. By saving money, we had to close down services, and that affected the local people. A local person ain't going to travel 30 miles down the road to see a counsellor or to see somebody for their mental health appointment as such. It needs to be local, and the government actually forced every NHS trust, especially mental health trusts across the UK, to actually save money 10 years prior to COVID. And the moment COVID come in, they want to invest in mental health. And basically, they were squeezing us on every year. And I've got documents and paper to actually prove this, that what the government has done. I'm all for mental health services, whether it's the Birmingham mayor is Conservatives, and I actually support him investing in mental health, or it's the Manchester Mayor Andy, who I know quite well for many years, who's always speaking highly of investment in Manchester, rightly done so. But it's all about coming together and making sure if we look after our mental health of the young people, then the future is bright. But if we neglect the children today, then I can't see tomorrow improving at all.
Thank you very much. Now, I don't know if my technically minded colleague can tell me if we've got any YouTube questions. I've got one electronic question that has been sent to me, unless there's anything from the draft. No, I'll put this. This may be the last question, in fact. This comes from yet another doctor, in fact. Sorry, it's disappeared from my screen. Where is it? From yet another doctor, Dr. Avik Bhattacharya, that says, is there a quantity-quality trade-off? Can we build healthier homes without slowing down construction numbers? And does that mean conceding defeat on house building targets? So quality trade-off and house building targets. Anybody who wants to go first?
Can I just say the house building targets, they're arbitrary. I mean, 300,000 homes we need. It doesn't tie into the hard, robust evidence. It could have been 250, it's 350, and we've been building close to that number, and we haven't seen house prices going down, unfortunately. So I will be less worried about hitting an arbitrary number than actually building a more quality houses that less in number, who are actually genuinely affordable.
Thank you. Sue, is there a trade-off there?
There doesn't have to be. If you are able to have a carrot, which is you must develop, as well as your biodiversity net gain, you must have a health net gain, or even just something really simple like a planning condition that says air sensors in all your developments and constant air quality management, just something that simple. That's not very expensive, but that would deliver metrics about health that were unavoidable and would deliver change. But there could also be, as well as the stick, there can also be the carrot of the incentive. We have developers now who are providing 100% affordable housing developments because the cost is less than a commercial development because of the SIL rebate. If you had a SIL rebate for health, that would also incentivize healthy homes.
Thank you. Daniel.
Yeah, when we were talking earlier about examples and cases we could look to about how to do this stuff well, mentioned the new towns as a potential lesson. I think that's also a demonstration of how you can build a lot of homes and, in general, have high quality, and that can go hand in hand. Building new homes which are high quality is you build more homes, but also it's a relatively fast way of improving the quality of people's living conditions just across the board and at mass scale. So I think there are lessons again to be learned from the new towns periods of our history.
Thank you. I'm going to give the last question, a quick fire question to my SMF colleague Richard Hyde, who had his hand up earlier on. He will ask you a question crisply in 30 seconds. You will each be able to answer it in about 45 seconds, and then we'll wrap up. Because I can see at the back of the room, the keen staff are taking away the bacon from the bacon sandwiches, and I think we'll want to get at least one more bacon roll before the session ends. So, Richard, off you go.
Okay, well, very quickly, beauty has sort of made its way into the planning and development agenda recently. Does the panel agree that A, beauty can be important for health of the people living in the urban environment? And if so, is what the government doing going to deliver that? More beautiful housing. Beauty
for or against? Who's?
I can jump in on this one. I'm so glad you asked because I actually did an essay on this, and I said Proust said beauty is a series of hypotheses, and we should not. I'm really not interested in beauty. I'm interested in quality. Beauty is for a different agenda. Thank goodness they didn't have a definition of it didn't add a definition of it to the framework. Personally, I think it's a little bit of a diversion. We know what's beautiful, but there should be more access to health than beauty, in my view.
Okay. Daniel, I'm going to give Charles the last word here. Daniel, you.
Yeah, I agree.
What's about beauty?
I think focusing on the concept of beauty specifically is largely a distraction. Beauty is entirely subjective, obviously. My version of beauty is probably the Gothic or the Baroque, but we shouldn't go around building loads of homes in the Baroque style, probably. No, I think that kind of more of a laser focus on quality in terms of the outcomes it brings is what matters.
Thank you. Charles, what do you make of the beauty agenda?
I kind of agree with the other panelists, but also support that whole beauty agenda because it drove attention to how ugly some developments are in this country, especially in the last 15 years. Transport for New Homes highlighted that in their research, and it was a tremendous research. One of the quotes from the Beautiful Homes report was that we built less beautiful homes compared to our Georgian and Victorian ancestors and Virgin ancestors, which should tell you a lot. I mean, and if it brings healthy homes, quality homes, I'm all for it. At the moment, I'm not sure what impact it will have, but I would like to stay optimistic, but I'm not sure.
Thank you very much. Now, as we're looking at the clock, it's just ticked over to 12 o'clock, which is our allotted finishing time, and I can see the last of the bacon disappearing over the horizon, so I'm quite sad about that. But I'm very happy that we've had a very interesting and educational event, both here in the room and online. So thank you to the YouTubers. I'm just going to wrap things up at this point. My finger was reaching to the button where I end the call, so I can't do that anymore. But I will just say thank you to you all for coming, and thank you to our friends at Policy at Manchester for partnering with us on this event. And maybe since we're in the room, we can instead of pressing the applause button, we actually do a small round of physical applause for our panel.
Thank you. Thank you, James.